DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. Thanks for joining us today. Today, we're going to discuss toe abscesses. It's something that we see commonly in cattle. Unfortunately, it's easier to prevent than it is to treat. So stay tuned and welcome to the show.
Bovolus Nasalgen 3 offers young calves unrivaled protection against devastating respiratory diseases, including IBR, PI3, and BRSV. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose Bovolus Nasalgen 3 PMH, the first and only intranasal that protects against viral and bacterial pneumonia. Talk to your veterinarian and visit nasalgen.com to learn more.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. I'm your host and your guest today. We're going to talk about toe abscesses. First of all, what about me? I am an owner and operator of Production Animal Consultation, which is a feedlot practice. We cover about 25% of the fed cattle in the United States, providing veterinary services. Great group of veterinarians, and I'm also a professor here at Iowa State University, where I help with feedlots here in Iowa and packers and pretty much anything animal health in the beef industry is my gig. So today we're going to talk about toe abscesses, but first we'll talk about a survey we did. We did a survey of feedlot operators, and there's really a couple of types of lameness that we see in cattle, either infectious or non-infectious. And the one thing they always told me in veterinary school is that 90% of the lameness that we see in cattle occurs in the foot. So when it starts to think, you start to trick yourself and think that it's higher up the leg, always go back to the thought process that 90% of lameness is in the hoof. And so when we asked people about infectious types of lameness, which would be foot rot or hairy heel wart, otherwise known as digital dermatitis, or we asked them some of the causes of what they thought about non-infectious, which would be things like sole abscesses, sole bruising, and toe abscesses. So when we see the infectious parts, the most common risk factors associated with seeing increased foot rot and increased digital dermatitis or hairy heel wart was pen cleaning, pen conditions, climate, things that go along with environment and hygiene for the cattle, okay? When we asked the feedlot managers, feedlot veterinarians, and feedlot nutritionists what they thought the major risk factors were for non-infectious types of lameness, such as sole abscesses or toe abscesses, they came back with the most common causes or risk factors of that are the temperament of the cattle, our cattle handling practices, and the surfaces of our working facilities in which these cattle flow through at processing or reimplant or things to that nature, okay? So we kind of break it down into, and those are the four main types of lameness that we see in feedlots: foot rot, hairy heel wart, toe abscesses, and sole abscesses. Toe abscesses generally occur on the hind limb, and they generally occur on the medial claw, so the inside claw on the hind limb. And a lot of times these are occurring because these animals that are have worse temperament are trying to get to the middle of the pack. And so remember that the animals on the outside in a herding experience, the animals on the outside of the herd are the ones that are preyed upon. So if we're pushing cattle, or if we put them into a pen and we're coming into a pen, they're going to try to attempt to get to the middle of the herd because they don't know whether or not you're a caregiver or if you're a predator. And they're still trying to figure all of this out. They're in a new environment. So understanding the amount of pressure that we put on cattle, the reaction that the cattle are trying to get to the middle of the herd, I think is really, really important as you read the cattle and understand that as they increase in flightiness or less acclimated to humans, the higher the risk there is to toe abscesses. So when we come back, we're going to talk a little bit more about the causes of toe abscesses, and we're going to look at some hooves to kind of further demonstrate and understand what's going on. You're watching DocTalk, and we're glad you joined us.
DNA Dialogue is brought to you by Identity Feeder, powered by Neogen.
There's certainly risk for producers because of the financial stake we have in the cattle operations, that we really need to protect our risk, and especially when there's things outside of our control that are happening in the industry, whether that's the general public or beef-centric issues within our industry, things such as black swan events that we talk about. So what can producers do to help minimize those risks is really very much from individual to individual. If you're able to withstand some of that risk and don't feel like you need to protect yourself, you know, that's a risk management strategy in itself, just saying I'm not going to have a risk management strategy. I think though for most people, taking into account that these events that may be out of our control, what am I willing to stand and how much risk do I need to protect? So there are ways to do that. Obviously there's the traditional ways of helping decrease your risk exposure, such as futures. Obviously there's the LRP program now, as well as options like put and take. So I think if you are at risk of financial catastrophe and can't withstand some of those events that are outside of our control, you should really consider those different strategies. More so on the other side is frankly, one way to manage risk is to always have continuous turnover of cattle and marketing windows across more times of the year. So for example, if I'm always marketing my calves as weaned calves, I'm really at the risk of what is the price every time in the fall on my marketing date. Whereas if I market a few dates, maybe I just slowly transition into going from one marketing date to 3, hold on to some of the calves, maybe put some extra weight on them, I spread out my marketing windows. That's one way to also manage risk. If you're a feeder, of course, the other way is you're continuously marketing cattle and continuously refilling those pens. Again, that's a marketing strategy that minimizes risk across different times.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Identity Feeder. Identity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Identity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Identity Feeder.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey there, welcome back to DocTalk. I'm Dr. Dan Thomson, and thanks to my good friend and colleague, Dr. Eric Rowe at Iowa State University's College of Veterinary Medicine. He's an anatomy professor. He loaned me a hoof, and we're going to talk a little bit about what's going on. So as I mentioned earlier, cattle are trying to get to the middle of the herd. And if we have hard concrete floors in our working facilities, which most of us do, and these cattle are extremely flighty, and we bring too many in, they're trying to push really hard with their hind limbs to get to the middle of the herd. And some research out of Canada showed that they press so hard that they actually separate the white line of these hooves. So as I open this up, two things we need to think about. This is the coronary band, the junction of the hair in the hard hoof wall. And the hoof wall grows from the coronary band down, you know, as toes get longer, and just like our fingernails grow from the bed forward, so do hooves. On the bottom though, the sole of the hoof, it is not connected to the hoof wall. It actually grows from the inside and grows that soft bed down, okay? So this is what we call the sole, this is the toe, this is the hoof wall, and then the juncture in which we see between the hard hoof casing and the sole is what we call the white line, okay? So right here is a place where it can actually separate. It's not grown all in one casing. And so the hoof wall can grow forward and the sole stays put, okay? And so this white line right here. So these cattle, they push so hard when they're trying to get to the middle and they're on that hard concrete, we actually get a separation at the white line on this toe that allows manure to quickly enter, or they push into the manure on the concrete, and the manure gets inside this toe cavity, which right here is P3, or the coffin bone, okay? And so as that manure gets trapped in here, that thing goes back together, okay, as they relieve the pressure. So now, and I always remember people tell me these were sterile abscesses because we couldn't find a hole, like a nail hole or something like that. But researchers in Canada have shown where they took a mechanical, robotic type thing with some hooves from animals at slaughter facility. They put so much pressure that they could actually separate that white line and show that this is the cause of the toe abscesses. So as that separates, then the manure gets in here, causes an infection around that toe, but it actually will rot that P3. So when it gets inside this case, the infection, the pus, if it keeps to growing, it's got to go one of two ways. It either has to come out from around this coronary band where we'll see them rupture above the toe, or it's got to wick up the leg, as we can see through the lymphatics and through the ligaments and tendons, where it will go to the hock and go to the hip. And unfortunately, these are not very successful cases to treat. And I have a lot of times thought that these animals with toe abscesses are having issues in the stifle, because it does, until these animals get painful in their toe or in their stifle, we don't see the changes in locomotion scoring, or we don't see them changing in their gait. And generally by the time we see the lameness, this thing has already caused the rotting of P3, and it's already started to track up the leg. So that's really what we're seeing with toe abscesses. When we come back, we're going to talk a little bit about prevention. We're going to talk about treatment. You're watching DocTalk, and we're glad you joined us.
CattleCon 24 is marching onward to Orlando, January 31st to February 2nd, 2024. Have your say in the future of the industry, network with fellow producers, or connect with friendly faces. Plus, the NCBA trade show will be on site with over 385,000 square feet of the latest and greatest in the cattle business to help your operation stay competitive and sustainable. Register today and learn more at convention.ncba.org.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
From sunrise feeding to midnight calving, It's planning and prepping every last detail so your family can enjoy the finer things in life. It's careful feeding, impeccable breeding, and herd health protocols to keep your slice of the industry forging ahead. More than just a website or print catalog, we're a dedicated partner with everything you need right when you need it. valleyvet.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson, and we're going to talk a little bit about when we get a calf with toe abscess, okay? And the first thing you have to do is you have to pick up the foot. And unfortunately, you can't pick up the foot the way that I'm picking up the foot because it's attached to a big old steer or heifer. But we have to pick up that foot and we have to determine what the issue is and get a good diagnosis. So we know the animal's lame. The first thing we're going to do is look between the claws. And if we have an infection between the claws up here in the skin area that smells really bad, that's what we would see with foot rot. We will then turn around and look at the back of the foot, and right here in this area, if we have a strawberry type lesion, that would be, right here is where we would see hairy heel wart, okay? Now, if we don't see foot rot and we don't see hairy heel wart, you have to get your hoof testers out. And the hoof testers, if we grab a hold of this and it's sore all over, pretty good idea that it's a toe abscess as we pinch with the hoof testers. If it's a sole abscess, or something like if you've ever had a blood blister underneath your fingernail and you can pinpoint exactly where that pressure is, with a sole abscess, we'll see the animal will retract when we use the hoof testers in that spot. We can then sand down and then we will drill down to relieve the pressure out of that sole abscess or where that abscess occurs in here. But with the toe abscess, remember the white line comes together and it slams back shut and that abscess has no place to go and we get that rotting of P3. Case fatality rates, when we do get a toe abscess, what are we going to do to treat? We basically have 3 treatments. Do nothing. We can tip the end of the toe off, or we can remove the entire claw. Remember, these are usually on the back limbs. Cattle carry 60% of their weight on their front limbs. So when we relieve or take a claw off the back, we're not going to put a whole bunch of more weight load. Only 40% of the animal's weight is on the back limbs. So we have more success when we remove claws. And you'll want to use a veterinarian to come out and help you with actually do this procedure. We have not, when we tip the toe, you want to tip it back far enough to just a bleb or a bead of blood comes out. If we tip it too far back and you create a hole, these animals will just pack manure, they won't heal, it's too much. But if you trim it back to just a pinhole, when this animal steps down, it's like a piston and it'll actually spray the bad stuff out and hopefully not track more bad stuff in. And so trimming it back just a little bit once we diagnose it, removing the claw or doing nothing. Unfortunately for us, when we treat these, we have a 50% case fatality rate. And when I necropsy these animals that die or we euthanize because they become so painful, they start to lose weight, they stop eating. When you start to see them getting tight-gutted when I open them up and I look up that leg, they will actually track that infection up the lymphatic system, into the hock, into the stifle. But it all started at the foot. 90% of lameness is at the foot. So we can tip the toe, we can remove the claw, we can do nothing. But the one thing you want to do is get them off concrete. We want to put them on dirt. We want to put them, a lot of times we put them out in a pasture just to give a tincture of time. Antibiotics don't help in these situations. Might help if it's a septic joint or something that goes septic in the animals, but by that point in time, we've got a case that's not got a very good prognosis. So we're going to take a little break. We're going to come back because prevention is the key with toe abscesses. You're watching DocTalk. Thanks for joining us.
The cost of an open cow these days is very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so alertness test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. We're talking about toe abscesses. And in my practice with Production Animal Consultation, we see these toe abscesses in cattle usually around 30 days on feed, and they occurred at processing or they occurred at the auction market prior to shipment. And so the thing that wild cattle, scared cattle with inexperienced cattle handlers and concrete create toe abscesses, okay? So we have to look at ways to prevent it. Getting people more experienced with handling cattle that are scared or flighty, helping cattle move in smaller groups is important. And the other one is focusing on the flooring within the facility. When we start to think about toe abscesses and flooring, a couple of things come to mind. One, we used to just put wood chips, big coarse wood chips in our tubs and in our lead up alleys, something to create some cushion for those cattle when they come in and are having that contact with the concrete. But we have to clean that. We can create some issues with wood chips. And what we've really seen recently is the replacement of wood chips and things like that with rubber matting. And there's a company called Animat that has rubber matting. There are other places that people are creating rubber matting that they can come in and custom fit it to your tub or to your snake so that cattle have a cushion or a give when they come in and they're making quick turns or they're flighty and they're trying to move to the middle. Those have made some significant positive impacts in our cattle feeding facilities and in our packing plants. And probably we'll start seeing these in auction markets as we consider this etiology of toe abscesses. So that's with the flooring. With the cattle handling, one of the big things is one, recognizing that the cattle are extremely scared or flighty. They don't know whether you're a predator or a caregiver yet. They're trying to figure this out. They'll learn it. But what we'll want to do is not to scream, holler. We want to keep low stress cattle handling and keep cattle flow moving. And one of the things is that when we bring cattle in out of a receiving pen into the tub, and if we have a concrete floor, let's just bring enough cattle in that can go straight from the tub or the bud box straight into the single file or the snake. Because when we get into some of the trouble and you start to smell that hoof burn on that concrete, is when we bring too many cattle in. They start to bunch up in a corner and they're fighting to get to the middle and they're trying to get away from you and they don't know where you want them to go. And so when they get stalled in that area, that can be an issue. So the big things for preventing toe abscesses, flooring, when we have flighty cattle, temperament of the cattle is the number one risk, has been associated with toe abscesses. But what we can do with the flooring to improve cushion and not having the abrasion or the splitting of the white line, and low stress cattle handling, not bringing cattle in too big of groups, those are some of the main focus areas that you can do. And we should be doing this anyway, right? Whether they're flighty or not. These are just good, solid cattle handling practices that if they're not done correctly, can have detrimental effects. When we see 10 head in a pen with a case fatality rate of 50%, that means a 5% death loss in these critters, when we could have made some adjustments in how we handle the cattle. And it's something we work on every day in our practice with our clients. Hey folks, thanks for watching today. Remember, if you want to find us on the web, you can go to www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson here in Ames, Iowa. Thanks for watching, and I'll see you down the road.
At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.